Good morning, everyone, and welcome to Sunrise Extra, our live streaming after show. It is Monday. Boy, the weekend was awesome. It was sunny, but it went way too quick. Hey, look who's back. Drew, after 2 weeks, it's so good to see your face.
Yes. You would think that 2 weeks would go by rather slowly, but I felt like those 2 weeks went by rather quickly, Brenda. I know we have a doctor joining us today, which maybe is good because I think I may need surgery to help remove this beard. I've never had this much facial hair. Oh, no. Literally in my life. I don't think I've ever let my hair grow out this long on my face before.
That is so funny.
Oh.
Let's introduce our guest real quick before we get too far afield. That is Dr. Lisa Gibbons. She is an OBGYN with the Cascadia Women's Clinic over in Vancouver. And the subject matter this morning, I really am interested in this because I know people who are pregnant right now, and I keep thinking, oh my gosh, what a stressful time. It's a happy time to have a baby, but during a global pandemic, oh my goodness. Dr. Gibbons, can you tell us a little bit about how it has changed what you do on a daily basis?
Well, I think for all of us, it's been obviously a stressful situation, and certainly, like you said, in pregnancy, ladies are, and families in general, are excited but also always a little anxious about their pregnancies, and with a pandemic it makes it even more so. So change-wise, I would say we're doing a lot of safety precautions and preventative things to help ladies and their significant others get in and out of the hospital quickly. And we've also pared down the frequency of our visits in the office to help decrease exposures to patients, and doing a lot of telemedicine like this, where we do a lot of question answering and a lot of hand holding over the phone and video teleconferencing with ladies.
Doctor, I'll say good morning because I haven't had a chance to do that yet. So for starters, good morning. Secondly, can you talk about the setting during births now? Because I can remember when our twins were born 12 years ago, we had extra family coming to town. I remember my in-laws were at the hospital. They were literally holding the babies within a couple of hours after they were born. I imagine that's not happening the way it once did right now, at least.
No, so the current recommendation, and our practice delivers out of Legacy, so I can speak for that, but I think it's true across the board, at least in the Southwest Washington area, that they're only allowing one support person in the room, and they are not allowing any other visitors. For a short period of time in New York City, when everything was really at its peak, they weren't allowing anybody in the room, which would be really, really difficult and stressful. Wow. So, so they are allowing one support person, but nobody else in the hospital, unless there's a birth, end of life, or a pediatric patient.
Drew, I know I've finally
and then we're also just trying to get.
Oh, go ahead, doctor. I didn't mean to interrupt you.
I was just going to say, and then we're just trying to get the moms and babies home as quickly as possible too. So normally our stays in the hospital are, a couple of days after a vaginal delivery, and typically about 3 days after a C-section. We're trying to pare that down and make sure that they get home and kind of out of that risk environment as quickly as possible, and give some counseling as to how they can interact with family members when they get home based on their comfort level. They're also doing testing now for everybody that's coming in for a elective procedure. So if it's a scheduled C-section, they're testing the patients, and they're also starting to test patients just coming in for delivery. Oftentimes we don't have those test results back before they deliver, so we're still using all the same precautions just to help staff members stay safe as well.
No, that totally makes sense. Drew, I was going to say, I finally placed it. I feel like you were meant to be here for this discussion, because with the facial hair, you look like a new dad. I think in those first 6 weeks, no guy shaved.
It's true.
No, you're right, Brenda. I've only had facial hair of any kind a few times in my life, and you're right. After the twins were born, I think I was off from work for 3 weeks. and I let this go a little bit. So that's it's a good point to bring up.
You know, I do like it though. I think you look fantastic. Doctor, I was going to ask you kind of about the mental health piece, because like we were talking about the stress of having a baby and then having all these other restrictions and maybe not having as much face-to-face family support for the new parents. Are you seeing anything with new moms and postpartum depression? Is there any more of it, or does that not really apply?
We still do our routine screening. So even if we're doing postpartum care, telemedicine over, video conference or phone, we're giving our ladies screenings, and we certainly talk with them before discharge from the hospital that this is a increased anxiety time, and that they certainly are welcome to call. We're available 24/7. One of us is always on call, and our ladies hopefully know that they should be able to call and get guidance and help through that. I don't know that we're necessarily seeing an uptick of postpartum depression, but certainly some anxiety-laden conversations that we're having to make sure that ladies know it's still safe and okay to breastfeed. The good news is they haven't found any sort of vertical transmission in the fluids and or around the time of delivery or before. So ladies are encouraged to breastfeed if they think that they are infected, or the health staff thinks that they're infected, then they'll do screenings, and certainly they're recommended to use mask and good hand washing skills, but those sorts of things. So talking through with our patients and giving them good education pieces, and then resources to call us if they're feeling more down and anxious, I think is important. And also just encouraging them to reach out still like you would. It's not the same as having mom there making dinner and helping with diaper changes, but it is important to be able to have those conversations and FaceTime with friends and family members and show the baby off and that sort of thing, because it's a special time and an important time for people to gather their people around them.
Doctor, I know our time with you is limited this morning, but I do want to point out the fact, if my notes here are correct, you are not only a doctor, you're also a mom. So happy belated Mother's Day. And do you want to share with us how you were able to spend Mother's Day yesterday with your kids?
They kind of spoiled me, but they are not early risers. I have a 10 and a 12-year-old, and they wanted to make breakfast in bed. And I said, how about I go back to bed, because I don't really want to stay in bed till 10 o'clock in the morning. But we spent the day largely at home and played in the yard a little bit. My son's a pretty avid soccer player, so we played in the yard a little bit, and then they made a nice Mother's Day dinner, and yeah, it was nice.
That's awesome. Low key and lovely. We so appreciate you joining us.
Yes.
You guys, this may be our shortest Sunrise Extra ever, but for good reason. Dr. Gibbons, I know you are rushing off to deliver a baby, a scheduled C-section, I hear, at 7:30. So we will respect that. Good luck. And again, thank you for all your advice.
Thank you so much.
We absolutely appreciate you.
Thanks for having us.
Yeah, you bet. And thanks for joining us, everybody. Thanks for joining us, everybody. That's Sunrise Extra. See you tomorrow.